Missouri leaders want to relax the rules about handling COVID-19 in schools. I'm Laura Moritz.
And I'm Kelly Eckerman. This comes as the state reports 35,000 new cases in November alone. KMBC 9's Michael Mahoney has more on the decision.
The change is aimed at trying to keep kids in school and teachers in class. Before, anybody at school directly exposed faced a 14-day quarantine. Now, no quarantine if both the infected person and the exposed person were wearing masks. Education Commissioner Margie Van Dieven says just too many kids and adults are out sick.
But quite frankly, it's exhausting and it is not sustainable.
A Washington University researcher says relaxing the quarantine rules will work at school.
The school environment has not contributed substantially to the spread of the novel coronavirus in the same way that it does for other respiratory viruses like influenza.
Right now, Missouri, Kansas City, we're at the highest level of COVID that we've been at. And now you're going to come out and say, oh, it's okay, you don't have to quarantine.
Kansas City Mayor Quinton Lucas doesn't like the idea either. Governor Mike Parson is defending how he's handling the crisis, but he's also using some very dark language now, that the next 4 weeks are critical.
The reality of it is we can't keep going at the pace we're going and keep doing the same old things we've been doing.
Nothing from Parson about any shutdown nor any statewide mask mandate, but he did say that all of Missouri needs to step up. Michael Mahoney, KMBC 9 News.
The North Kansas City School District reacted to the governor's announcement, saying it's in constant contact with local health officials and will not change its current mask and quarantine protocols. The University of Missouri is moving most classes online after the Thanksgiving break. Any student leaving campus for the holidays will be encouraged not to return to campus until spring. Residence and dining halls will remain open. Faculty and staff will continue to work on campus. This is a look at statewide numbers in Kansas and Missouri. It's the 7-day rolling average of new cases. Kansas is up by more than 1,000 cases over the past week. The Missouri average has increased as well.
Health officials from Wyandotte and Johnson County say they are considering new rules to curb the spread of COVID-19. They say something needs to be done to protect the public.
We're looking at and having conversations across the Kansas City metro area about what changes could we make in terms of gathering sizes, in terms of restricting that grouping of people that we think now is really causing a lot of spread. Because with the rates the way they are, as you said, everybody needs to assume everybody else has COVID that they're around.
Health officials say they're also behind on getting information from people with the virus because of the surge in cases. Now, on the other side of the state line, the City of Independence is requiring more staffers to work remotely in response to the rise in cases. The mayor says all city employees who can work from home will be required to do so. In the past 2 weeks, more than 20 city staffers have tested positive. 100 others have quarantined. Many facilities will have reduced hours. City Hall and police headquarters will only be open from 8 to 5 on Mondays and Thursdays. The University of Kansas Health System is postponing some elective surgeries to free up more bed space. Doctors are working to see which patients can safely delay their procedures. The hospital is also turning away patients from other states because of a lack of space.
Medical experts are weighing in on the development of a COVID-19 vaccine. This is part of a series of talks from Truman Medical Center. KMBC 9's Emily Hallwick explains where trials stand right now.
A vaccine could be given emergency authorization as early as next month, and when it is, frontline workers will likely be among the first to get the vaccine, but doctors warn it could be much longer before that vaccine is publicly available.
Doctors say the Pfizer vaccine, shown so far to be 90% effective, is expected to request emergency use authorization within the next 2 weeks. It could have approval in December, but availability will be extremely limited at first. Experts say it will likely take 2 doses to be fully effective, which would be given 28 days apart. Other vaccines are still in clinical trials as well, including one developed by AstraZeneca, which is being tested in part by Children's Mercy Hospital and KU Medical Center. Doctors say while we're waiting for approval of a vaccine and wide-scale distribution, the coming months are crucial to controlling the spread of the virus, which is taking a major toll on hospitals.
Even with the good news from Pfizer, we have some gaps in our knowledge. And even once an EUA is approved and we have their release of, say, 30 million doses, which would only cover 15 million people, we have the next 6 weeks to deal with.
Doctors say a vaccine might not be widely available to the public until the spring of 2021. And in the meantime, they're urging you to continue to take crucial precautions to stop the spread of the virus. Reporting in Kansas City, Missouri, Emily Hallwick, KMBC 9 News.
Right now, there are more than 100 companies involved in clinical trials. And as you just heard Emily mention, local hospitals are also working with AstraZeneca on a vaccine. Beginning this week, a mobile unit will be used to bring the vaccine trial to underserved and high-risk groups. It's scheduled to make stops at Truman Medical Center, Health Partnership in Olathe, and sites in the Wichita area.